So hello, everyone. My name is Cindy Blackstock, and I'm with the First Nations Child and Family Caring Society, and I'm Gitsan, and I'm here with our beloved spirit bearer, who represents all the First Nations children and all the other children who have stood up for justice in the long history of Jordan's Principle, and also, of course, for other children's services. It's a real honor for both of us to join you from unceded and unsurrendered Algonquin territory here in Ottawa. And we begin by paying our respects and honor to the different territories that you join us from. I'd like to particularly just take a moment to reflect that October 22nd, 2023 was Jordan's 24th birthday. It's a special time of the year where we give thanks for this sacred child who gifted us all Jordan's Principle. And I think for me, that's the important thing out of this entire conversation, is that Jordan's Principle is not just a policy, it's sacred, because it's named in the memory of this little boy. And that's why it's so important that we don't try to shorten Jordan's Principle to an acronym like JP, that we fully say his name, Jordan's Principle, in honor of that spirit of that child. Today, across the street, the federal court will hear arguments for the compensation of the victims of Canada's discrimination. That includes families who are discriminated against for Jordan's by Canada's improper implementation of Jordan's Principle. For that reason, I'm going to be doing the introduction for all of you, but then I'm going to have to leave, and Spirit Bear is too, to go across the street with federal court. But I want to give my gratitude to my colleague, Jennifer King, who will take over when I'm finished, so that both of us can go over and join the representative plaintiffs and, of course, many of the children and young people who came to Ottawa for these particular hearings. I'd like to also bring to your attention that there were recent submissions filed with the Canadian Human Rights Tribunal, including those on Jordan's Principle. So our friend Melissa will be putting those links in the chat for you, so you can see what the tribunal's been informed of and what the next steps are. There's probably going to be a case conference with the tribunal in early November where they will decide what the next steps are. I just want to remind everybody that Jordan's Principle actually had its birth in many reports that came before we called it Jordan's Principle, including the Joint National Policy Review. I was actually just meeting with some of the young people who will be receiving compensation due to Canada's discrimination, and they're from Kahnawake. And Kahnawake was a place where we had many of the meetings for the Joint National Policy Review. That's back in 2000. There was a recognition of these jurisdictional disputes and how they were harming children. And then in 2005, of course, it became Jordan's Principle. And in 2007, the House of Commons adopted it. And Jordan's family was there for that momentous moment. But his father, Ernest Anderson, said, "Don't let the good being done in my son's name today just be a moral victory." And for far too long, that's what it was, as Canada refused to call any child eligible for Jordan's Principle, even though we knew there were thousands of children out there with needs. It wasn't until the tribunal issued its landmark decision in 2016, finding that Canada was unlawfully and applying Jordan's Principle in a manner that created discrimination. That opened the door a little bit, but only a tiny bit, because the federal government continued to discriminate. It took more orders by the tribunal to ensure that First Nations children, regardless of their status, are eligible for Jordan's Principle as long as they're recognized by their nation. It took a lot of jurisprudence and litigation to ensure that Canada applied it for health, social, and education services. And then we had the timelines, which continue, as you're going to hear from our speakers, to somewhat be problematic, and the issues of urgency. So all of those are legal orders that Canada is required to do. Today, we're going to have three amazing guest speakers join us and share with you some of their thoughts around Jordan's Principle. some of the things that they've been learning, and hearing from you, many of you that have been on the call, from families themselves, and from the data when it comes to Helaina Gaspard from IFSD. So to give you a little bit of a preview, we're going to begin with Helaina Gaspard. And many of you know Helaina. She and her team have been doing some amazing work in First Nations communities, helping us to create a bottom-up approach to funding in child and family services and also in Jordan's Principle. Today, she will be sharing with you what the Department of Indian Affairs, or ISK data, I guess, I'm dating myself using the old name, what it actually shows in terms of what's happening with Jordan's Principle. And then we're going to hear from Dr. Ryan Giroux, who is a pediatrician with St. Michael's University and also a member of faculty with the University of Toronto Medical School. And he's going to present on a study the Canadian Pediatric Society has done, kind of a survey of pediatricians about what their experiences have been with Jordan's Principle and what their knowledge levels are. And finally, but definitely not least, is our own Molly Rasmussen, who is here at the Caring Society, and along with colleagues Jennifer and Brittany Matthews, do an extraordinary job trying to assist families and coordinators in implementing Jordan's principles, particularly the CHRT rulings. So that is what we have in store for you today. And we're also going to be posting links to different information sheets and then different resources that you have available. So I think that's it for Spirit Bear and I. Again, we just really want to thank you for joining us, and we'll turn it over to the amazing Helaina Gaspard to begin.
Thank you kindly for the introduction, Cindy. It's a pleasure to be here with you to talk a little bit about, as Cindy said, some of the work that we've had the privilege of doing with colleagues across the country. So the Institute of Fiscal Studies and Democracy, we're a research consulting firm. We're hosted at the University of Ottawa, and our expertise is in public finance. So just as Cindy said, what we help to do is we help to put a financial language around some of the things that are happening on the ground. We try to bridge that gap between the realities inside of communities, the needs of children, and what that might look like if we were to translate it into, let's say, a public finance language. So what I wanted to talk to you about today is the work that we've done with Jordan's Principle. So just last September, we released a report assessing information that was shared by Indigenous Services Canada, by ISC, about Jordan's Principle. And the main finding, the crucial element from this work for us, was that IFSD could not understand if substantive equality was being achieved by Jordan's Principle based on the information that we were provided, based on the information that we had access to. And so what we can see are a host of other considerations. So what we know about Jordan's Principle is, of course, that it's addressing needs on the ground. Those are real needs on the ground. Where we have much less information is why children and families are seeking support through Jordan's Principle in the first place. Getting to the root causes of why children are seeking out support from Jordan's Principle is really, really important. Because as we'll talk about later, we're seeing from the available information that there are lots of requests, and that requests are for smaller amounts of money. And so that tells us that there must be gaps in existing programs and service areas that need to be addressed to help support, kids no matter where they are. And so that's why, to us, this type of analysis, this type of work matters so much, because we know that if Jordan's Principle is closing gaps for kids, that's great, but that also means that there are bigger questions at play about why and how. Part of what we do is we use public finance language, and that's not because we're being crass. It's not because we're not aware that we're talking about children and something so sacred, but it's because it's one way of trying to help move this piece forward. It's one way of trying to come to a different way, or hopefully a better way of thinking about supporting the needs of children and families. So what we see here on the screen in this image is part of the challenge that we see when we look at data and available information from Jordan's Principle. Right now, we have lots of information about Jordan's Principle on things that we call inputs. Those are things like how much money was requested, what was the service category that was requested, what was the program or the service that was requested. Those are inputs. That tells us basic information, the sort of who and what and when and how much, right? Those are those input questions. We have lots of information there. We also have information about things that we would call outputs. What were the pieces that were approved? What were the actual objects or programs or services that were purchased using Jordan's principle? So we've got a pretty good sense of what's being asked for and what's being delivered from that information. The two big missing pieces of the puzzle here are the starting points or the context of First Nations children. And then also what happens to those children after contact with Jordan's principle. So without being able to draw those linkages, without being able to connect the pieces of the puzzle between the realities or the starting points of First Nations children, those inputs, those outputs, and those outcomes, we actually won't ever know whether or not Jordan's principle is supporting that goal of substantive equality or if it isn't. So even though Jordan's principle is doing so much good for so many kids, there's a lot that we don't know. And so why those requests were being made and what happened to children those are really important questions to answer, because that will help us understand more about what's going on around those children and what some of those long-standing gaps might be. So we had access to quite a bit of, as I said, input-related data from Indigenous Services Canada. Most of what I'll be speaking to today focuses on the fiscal years 1920 and 2020-2021. We know Jordan's principle has been in operation from the perspective of the data from about 2016. Part of the challenge for us, however, is that we don't have the same information. So ISC didn't track information in the same way or with the same parameters throughout that entire period. So most of what I'll talk about will focus on those last 2 fiscal years. The good news is that information gets better over time. So it's just maybe not perfect just yet, but it's definitely getting better over time. I just wanted to start with one important highlight. There was a 50% increase in requests to Jordan's principle only between 2019-20 and 2020-2021. That's a really important consideration here. Requests are increasing overall, expenditures are increasing overall, but that those requests increase in such an important way is an important signal that more demands are coming through. And so when we consider where requests were coming from or why requests were being made, what we can see is that most of the requests were tied to things like education and medical transportation. So you can see just from the frequency, just the sheer number of those requests and those associated categories, that's where most of the requests were coming from. And so those also mean that we should be paying attention, right? But again, even though we can see things like education or medical transportation or respite, the question needs to be, why did the family have to go to Jordan's principle in the first place? Was it because there were no services around them? Was it because they couldn't afford services? Was it because Jordan's principle could get them what they needed faster than the other programs and services around them? Those are important questions that we need to answer, especially if we want to help support kids, no matter where they are. Another important consideration from the data that we had access to was the nature and the size of the requests. Most of the requests that were coming through Jordan's principle were for amounts less than $5,000, right? That says something when we're thinking about it from a public finance perspective. That means that lots of requests, frequent requests, are coming through for small amounts of money. Even though we don't know exactly why children and families were going to seek support from Jordan's principle in the first place, we can make some guesses, right? We're guessing that many of these requests had to do with basic needs. We're thinking about things associated to deprivation or poverty, things associated to a basic lack or access to services. So that for us also means that no matter how big or how small the request, so you can have a request upwards of $5,000, it's going through the same process as a request for $200 or for $1,000. So those are also things that need to be considered in terms of access. And then when we think about access, we also have to think about delays and differences in the adjudication process. So when we look at those timelines across provinces, across territories, there's variability. There are places like Quebec and Manitoba that seem to have much shorter approval times than the rest of the country. We're spending some time now trying to understand why that is. What do those regional differences look like, and what can we learn? Are there things that other places can learn from Quebec, from Manitoba, from other provinces and territories about what works and what doesn't when it comes to adjudicating Jordan's Principles requests? Another piece that came out of the work was anytime a request is moved to headquarters, right? So if a request can't be approved at the provincial or at the provincial level, it's moved to headquarters. Only 20% of those requests that are moved to headquarters are actually approved. Actually, just under 20% are actually approved. The balance are denied. So that also says something about the way these requests are being triaged and managed, right? And we've also come to understand, and I'm sure colleagues at the Caring Society will be able to speak to this much more effectively, it sometimes might feel for those making the request that the information goes into a black box and that it becomes really difficult to track a request once it leaves that provincial or territorial level. So with all of those considerations from the available information or the information that we had access to for Jordan's Principle, started to raise a series of questions, right? Of course, why are children going to Jordan's Principle? You know, what are their needs? Are being concealed or are covered, right, by access to Jordan's Principle? But also importantly, it started to raise questions about how Jordan's Principle is understood in different places, how it's operationalized. You know, why do timelines for adjudication look so different in different places? Why are some things approved in some provinces or regions or not in others? And so this is where we were doing our next step in work here at the request of the Caring Society with the support of the Assembly of First Nations and the National Advisory Committee, is to understand, you know, what's the starting point here? What's our policy framework? What are existing programs and services that are adjacent to Jordan's Principle? And then what does it actually look like on the ground, and what can we learn from the ground? And once those three first pieces are in place, then we can start to talk about what are the costs associated to Jordan's Principle in the medium and long term, based on what we learned in those three pieces. So we're expecting that work will be ready by December 2024. And that's, of course, you know, reliant on new and updated information being shared by Indigenous Services Canada. And we're also really excited that we've got a regional working group, people that are practitioners and that are going to work with us throughout this project to help ensure that we're capturing the diversity of approaches, the diversity of needs when it comes to Jordan's Principle, especially from the practical operating realities of Jordan's Principle on the ground. And so, as I mentioned, there are 4 parts to this new work, and we would love to hear from those of you that are working professionally in Jordan's Principle. And we say that respectfully because we know that there are so many important and sacred stories of children and families. And we know what our role is, and we know what we're good at. And we also know that it would be, you know, in the best interests of children and families, and to keep those stories sacred and to keep them and to have them shared with people who can support them as they're sharing them. So we're asking that if there are folks that work professionally as practitioners in Jordan's Principle, and you want to talk about what works on the ground, what doesn't work in your community or in your region, what has worked for you, say, as a practicing professional that's engaged with Jordan's Principle, we would be really pleased, you know, to hear about those experiences, also in an effort to help make the work better. And so there's only so much that we can see from the numbers or from the data that I was talking about before to help make sure that we think through, you know, what Jordan's Principle might look like, how it can be, you know, better for the future. That'll take a lot of perspectives, definitely perspectives from the ground, definitely perspectives from those that are operating and working daily in Jordan's Principle. And so perhaps, Jennifer, I'll leave it there, and I'm very happy to answer questions later in the discussion. Thank you.
Oh, thank you, Helaina. Hi, everyone. So my name, as Cindy said, is Jennifer King. I'm a staff member here at the Caring Society. My family comes from the Wasauksing First Nation, and I am joining from actually just the other side of Cindy's wall. So Cindy and I share a wall. I'm also joining you from unceded, unsurrendered Algonquin territory. And with that, I guess we will move on to our second presentation. Unfortunately, Dr. Giroux is not here with us today, but he did put together a video that we're going to be sharing about the study that the Canadian Pediatric Society did with their members, about what pediatricians know about Jordan's principle, what they have observed with children trying to access Jordan's principle from their perspective as pediatricians. So unfortunately, we don't have Dr. Giroux live to answer your questions, but I did have the opportunity to present with Ryan about this study at the Canadian Pediatric Society conference last year. So not a doctor over here, not a pediatrician, but I have heard him speak about this study before and answer questions. So fingers crossed, if there's any questions specific to the study, perhaps I'll be able to, I'll try my best, let's just say. So with that, I do believe my colleague Molly is going to share the video.
Hi there, everyone. Thank you for allowing me to speak here. And I know if you haven't figured it out, I'm a recording. So unfortunately, I'm not able to make it to this this afternoon with you. However, I still am very excited to be able to give you a sense of some of the experiences that pediatricians have been having with Jordan's principle. And we'll launch right into it. Just to give a bit of background, my name is Ryan Giroux. I'm a general pediatrician. I am Métis from the Métis Nation of Alberta on my dad's side, and mixed settler heritage on my mom's side. I now live, work, and play in Toronto on Treaty 13 territory. But I grew up in rural Alberta on Treaty 6 and Treaty 8 territory. I do a lot of different work. My clinical work is actually focused mostly on urban Indigenous health. So I run 3 different clinics through St. Michael's Hospital and the Inner City Health Associates that focus on urban Indigenous health. And I also work in refugee newcomer health as well. Some of my advocacy work is within medical education, as well as through the Canadian Pediatric Society First Nations Inuit Métis Health Committee. So lots of different hats that I wear. And really this falls under some of the work that we've been doing at the Canadian Pediatric Society. So why am I speaking with you today? How did I get here? We did a study through the Canadian Pediatric Surveillance Program called the Jordan's Principle Study for short. The question that we were trying to answer through this study was, do Canadian pediatricians access supports and services for First Nations children and youth through Jordan's Principle? And through this, we did a survey of knowledge, behavior, and experiences. So I'm one of the co-investigators along with some other folks here. Our PI is Dr. Radha Jetty, who's a pediatrician out of CHIO in Ottawa, and a number of different collaborators, including those at the First Nations Caring Society. We've been really fortunate to be able to work together in this work. So we did a 25-question survey back in 2020 in both French and English. It was a mixed closed-ended and open response questions, and was sent to almost 3,000 pediatrician and pediatric trainees. And that was done in April 2020. The responses were taken in April and May 2020. So, this is a few years out, but I still do think that it has highlighted some concerns, and certainly some concerns that I continue to share in my own practice. So in terms of general results, we had 265 respondents, and that included general pediatricians like myself, subspecialty pediatricians, so that would be a pediatric cardiologist or pediatric respirologist, whatever, as well as trainees in various practice locations. So this includes academic in larger urban sites. This includes community based in small and large communities, rural, remote people as well. So quite a breadth of folks who participated in the study. All provinces and territories as well, except for Nunavut, had at least one respondent, with some of the most responses coming from Ontario, Manitoba, Quebec, and BC. Out of these 265 respondents, 219 had provided medical care for First Nations children and youth, and also completed the survey. So we know that pediatricians do see First Nations children and youth in our practices, and it is common, and we're pleased that so many of these pediatricians had the chance to complete the survey. The median number of First Nations patients that they had seen in the prior 12 months was 25. And I would say that my number is higher than that, but my clinic is focused specifically on Indigenous child health. So moving into some of the more specific results and really the meat of the talk here. So in terms of eligibility criteria, 10% were not aware of Jordan's Principle at all prior to the survey. So that does say 90% are, which is great. But out of the 197 respondents who were aware of Jordan's Principle, only 56% could correctly identify all of the eligibility criteria. And the biggest unknown at that time was First Nations children and youth without Indian Act status living off reserve and recognized by their nation. So almost half of people were unaware of this criteria. I will just say that this was before the Canadian Human Rights Tribunal ruling in 2020 that included First Nations children who a parent had Indian Act status. This survey was done before that point, so we haven't been able to know what pediatricians know about that part of it. But at this time, that was the biggest unknown. There were 137 respondents who were not familiar or said they were only somewhat familiar with Jordan's Principle. And 61% eligibility criteria was the biggest unknown. And then there was, up to almost a quarter said knowledge of services covered, and 18% said they just didn't know how to access the funding through Jordan's Principle. In terms of experiences with access, I can speak to my own experiences, but I'll let the data show for itself. So while many, like I said, knew of Jordan's Principle, we know that only 59% or 129 respondents had ever actually tried to access supports themselves, or even through a delegate like an allied health care worker or community provider. And of the remaining 41% who hadn't tried to access supports, these were some of the common responses. Not all of them, there are more responses than this, but some of the more common ones included none of their eligible patients needed to access services through Jordan's Principle. So that was about a third. 40% said they did not know what services were covered, and 33% said they didn't know how to access funding for services. So, there's certainly still a gap of, we know this exists, but how does this actually fit into how we provide care to our patients? A little bit more data on this. So 39% reported that they or a delegate or a patient had encountered difficulty in accessing funding on at least one case. So nearly half. And I will say my own personal experience, I've certainly encountered difficulty in accessing funding. The most common barriers included difficulty reaching someone to assist regarding the application. So that was 60% of people, almost 2/3. Excessively time-consuming application, more than half. Difficulty in navigating the process of applying for funding through Jordan's Principle, which was half. And then an unreasonable amount of information requested at 47%. So those are some of the biggest barriers when people have encountered difficulty in accessing funding. I also do think that really knowing what has happened and what pediatricians have said is important. So these are quotes that come directly from pediatricians who participated in our survey in terms of their experiences with access. So one said, "No one returned my call or parents' calls. We're still waiting for requests submitted months ago." Another said, while someone may get back to you relatively quickly, getting actual funding approved takes months, and some cases just never gets completed at all. Another one said, we were informed that requests had to come from the family and that we, physician's office, could not act on their behalf. And last said, asking me to repeat referrals sent multiple times. So, and I can say based on my own practice that I've certainly had many of these same experiences. And certainly it can be quite a frustrating experience when you're just trying to get the service that your patient needs and that is medically necessary. In terms of delays or denials, this is also something that we were quite interested in the study. So for delays, non-urgent cases, 69% of respondents said that they had no cases that were processed within the 48-hour standard, and with 32% reporting longer than 7 days for the longest processing time. I can say in my own experience, I have never had anything approved within the 48-hour standard. It certainly has been up to 6 months at times, despite advocacy on my part and of the family. For urgent cases, only 3 of 22 respondents had any cases that were processed within the 12-hour standard. And then about a third of pediatricians had at least one denial, with 23% reporting 1/4 or more of their applications were denied. So a significant number of denials. And where does this actually lead us to in terms of outcomes for our patients? We know that there's delays and that these delays cause harm. So 28% of pediatricians reported that there was a negative outcome for a patient or family due to delay in accessing Jordan's principle. So this can be in a variety of different realms. Some of the more common impacts include developmental or educational concerns. So, you know, if someone's not getting the developmental educational needs, it can further worsen or further continue the gap between their educational or developmental attainments. Medical complications, worsening mental health, not only for the individual, but likely for the family as well, and unnecessary separation from the family, particularly for those individuals who live on reserve or in rural remote areas and have to stay in an urban environment while waiting for services to be in place. There's delays of therapy and therapies that we know are medically necessary, and prolonged hospitalization that may or may not be due to just a medical reason for being hospitalized. And again, the quotes I think are really going to speak for themselves. So here are 4 additional quotes, again, coming from pediatricians who are on the ground doing this work. If we had to rely on Jordan's principle only, the child would not have received medications on time and would have required emergency airplane transport. Prolonged hospital stays for months recurrently while trying to get services into the rural remote home. Another pediatrician said, while the funding is in place, the accessibility of resources remains a challenge. And then another pediatrician highlighted declines in medical health and mental health due to delays. So I hope this gives you a short sense of you know, some of the experiences that pediatricians have had, and I can say continue to have with utilizing Jordan's principle. Gaps still do remain in the successful implementation of Jordan's principle, and our data helps to support that notion. Pediatricians, while often knowledgeable about Jordan's principle, do have gaps in their knowledge and are often faced with barriers in assisting their patients with accessing funding and services. And last, harm has been noted by pediatricians to their patients due to various factors when trying to utilize Jordan's principle. So again, I want to thank you for allowing me to be part of your day. And again, my apologies for not being able to make it in person, but I hope you have a good rest of your afternoon. And I'm happy to, the First Nations Caring Society knows how to get a hold of me, so I'm happy to continue to work with you if you'd like. So thank you very much.
Well, thank you, Ryan. Thank you, Ryan, for that. Too bad he wasn't here because he is a really knowledgeable and knowledgeable person and excellent speaker. I think for us at the Caring Society, what the study by the Canadian Pediatric Society really situated is the fact that we have what we might consider the most top tier type professional group, right, in Canada, who are presumably pretty familiar with bureaucracy, right? If you can get yourself through undergraduate degree, medical school, get all that training, you know a thing or two about paperwork and jumping through hoops, right? And if we have the, you know, this class of professionals coming forward and saying, hey, we are having the same difficulties that I'm seeing in the Q&A here, the things that folks are talking about in terms of the challenges or the barriers they've encountered in their practice with Jordan's principle, or as a parent or a guardian. Pediatricians are experiencing the same thing, right? And so that tells us if a pediatrician is having trouble, what hope do we have is kind of like the rest of us, right? And I can say that because I'm not a doctor. Next up, we're going to have Molly from our office. Molly and I don't share a wall. We have an office in between us, but we do share a floor. And so she's also joining you today from unceded, unsurrendered Algonquin territory. Molly is going to take you through the concerns that the Caring Society has identified in the last, I don't know, Molly, year, would you say?
A little over a year, yeah.
A little over a year. And you are going to see that a lot of the concerns that we've identified are ones that you are flagging in this chat also. So I see, folks are talking about reimbursements, right? And absolutely, reimbursement is an issue that's come to our attention here at the Caring Society. It is one thing to have an approval, but what do you do with that approval in terms of actually being able to pay for the service or support, or to be reimbursed if you're in a position to be able to pay out of pocket? Not everyone is, and nor should they have to. But we are aware that there are families that are putting this money forward thinking they're going to be reimbursed, and months and months and months go by, right? And that's not what Jordan's principle should be as an experience for families. So definitely reimbursements. I see concerns about the timelines here in the chat. So Molly's going to be talking, about that as well. And so I think with that, Molly, if you want to, introduce yourself and then go into the presentation, and then following Molly's presentation, we can have a bit of a discussion as a group, or at least as much of a discussion as we can have with the panel and 300 participants, but we will try to talk through some of these questions that we have. So Molly?
Thank you, Jen. Thank you for setting the stage and for pointing out that some of these questions are going to come up throughout the course of the presentation, but of course we will revisit them all as a group later. I'm very pleased to be here speaking to all of you. My name is Molly Rasmussen, and I am the Reconciliation and Research Coordinator here at the Caring Society. I've been in this role for about a year and a half now, and specifically working directly on Jordan's principle for the better part of a year. So I definitely don't know everything, but I do have enough sort of exposure to the way that these things work and some of the challenges that a number of you watching the presentation will have likely experienced. So I will do my best to address all of these concerns as well. I'm a settler originally from Fort William First Nations territory, or Thunder Bay, but have been a guest on Algonquin lands since 2014, almost a decade. So without further ado, I will share my presentation. Okay, so as mentioned, I'm going to be taking you through the back to basics approach, which is intended to improve outcomes under Jordan's principle. So I was very grateful that Cindy, and to an extent Jennifer and Helaina and Ryan, all provided the important emphasis on the fact that Jordan's principle is really about one boy. We're all here today because of the memory of one boy, Jordan River Anderson. And I wanted to address, Cindy has already brought this up near the beginning, but the importance of not using the acronym JP, because as we'll get into, this really obscures the fact that Jordan's principle is about a child who died as a result of government discrimination. And using that acronym really blurs that fact and doesn't keep Jordan at the center of what we're doing. So just to give you the overview, I'm sure you're all familiar, but Jordan's principle is a child-first principle and legal rule that ensures that First Nations children, regardless of whether or not they have status, regardless of where they live within Canada, can access whatever supports they need in order to be healthy and safe when they need them. So I wanted to emphasize the principle and legal rule to make it clear that Jordan's principle is not a policy, it is not a program, there are no stacking measures. So just because a child is eligible for supports through the provincial or territorial systems, does not mean that they need to exhaust all of those supports before they can be eligible for Jordan's Principle. But this is really a sacred responsibility on the part of all levels of government to address and prevent discrimination against First Nations children. So it would be so great if we had enough time to really go through the full and complete timeline of the events that led to what we're going to be talking about today, which is back to basics. But in the absence of that time, the latest that I think it's important to touch on is 2016, where we had the release of the Canadian Human Rights Tribunal decision, which found that Canada was racially discriminating against 165,000 First Nations children and their families by providing flawed and inequitable access, or funding rather, to the on-reserve child welfare system, and by failing to implement Jordan's Principle to the full extent. So the tribunal issued 4 remedies. Number 1, stop the discrimination at the level of the child welfare program and prevent it from happening or from reoccurring. And number 2, stop the discrimination at the level of Jordan's Principle and prevent it from reoccurring. So in the immediate term after this decision was released, Canada said that it welcomed the decision and that it would do better. It made the commitment. However, as Cindy mentioned earlier this afternoon, since 2016, there have been 28 additional orders issued by the tribunal against Canada. Many of them have been non-compliance orders. So that means that Canada has been actively choosing not to comply with tribunal orders on Jordan's Principle and to make the necessary changes to really make sure that the discrimination stops. So in early 2022, this is the context under which ISC implemented the Back to Basics approach. So Back to Basics is a guideline that all staff must follow. So all Indigenous services staff, whether you are the call center agent picking up the phone to the highest level of decision maker involved in a request, you have to follow and abide by all of these principles. So the intention behind Back to Basics was to bring Indigenous Services Canada's approach to Jordan's Principle closer to being compliant with the tribunal orders. So the basics that we are trying to get back to are all of the items that are reflected in the tribunal orders that if Canada were to do, Jordan's Principle would truly be non-discriminatory. In that sense, we can also think of Back to Basics as outlining specific rights and responsibilities. So when we're thinking about rights, we're thinking about what are the rights of the children or the families or anybody who's involved in making this request from the outside? What are their rights? And then what are the responsibilities of Canada and of all of the federal employees who are involved in those requests? What do they need to be doing to ensure that Jordan's Principle is operating in a way that is compliant with the orders and is non-discriminatory? So there are a couple of key pieces to the Back to Basics approach. Number 1, it is rooted in the principle of non-discrimination. Jordan's Principle exists as a remedy to discrimination. Jordan River Anderson passed away as a result of discrimination. So the idea that Jordan's Principle needs to be non-discriminatory or that children can access Jordan's Principle without discrimination is paramount. Folks who are adjudicating or working on requests need to also keep the children at the center of what they're doing. Whatever determination is being made, children's needs and best interests need to be at the center of this process. Now, folks working on requests also need to be considering distinct community circumstances. So for instance, if a request comes in for a child who lives in a community that does not have access to clean drinking water, what does that look like in the context of your determination? If this child needs, access to groceries, this piece of information about where they live needs to also inform what you're deciding about that request. Now, on the side of the families and other support people who are accessing Jordan's Principle, it needs to be simple. It does not need to be an overly bureaucratic approach where folks are having to go through multiple different levels of the government department or submitting, extremely excessive amounts of documentation. It needs to be simple. And to that end, it also needs to reduce the administrative burden on families. That is a very key component to Back to Basics. Families don't need to be shouldering that sort of burden. ISK can take this on. And finally, I know that we've talked about the determination timelines. Jordan's principle needs to be timely. The Canadian Human Rights Tribunal issued legal rulings about the timeframes during which or by which ISK needs to be letting families know whether the request was approved. And there are specific timeframes for urgent individual requests, urgent group requests, non-urgent individual and non-urgent group requests. And as many of you know, you've mentioned in the Q&A, they're not following these orders. So we will get into that as well. Finally, central to Back to Basics is the fact that substantive equality needs to be presumed and ensured throughout the entire lifespan of the request. And Jordan's principle also needs to take culturally relevant service provision at the core. So this kind of plays into the rights of the family and the child when they are determining what is going to be best for their children. So Back to Basics also helped to do away with a lot of very harmful practices that Canada was integrating into Jordan's principle before. So there are a number of key presumptions to help mitigate these things. So number one, professionals and elders are presumed to be acting within their area of expertise when making a professional recommendation about the child. So this is now, enshrined in Back to Basics, because previously Canada would actually override these recommendations. And it would say, if a child was recommended to have counseling supports once a week for 10 months, Canada might come back and say, we're only going to fund counseling supports every 2 weeks for 6 months. And they would effectively insert themselves into the circle of care and make these considerations based on things like cost. That is no more, according to Back to Basics. Similarly, parents and guardians are automatically presumed to be acting in the best interests of their child when consenting to a request or to a service. So there should be no more questioning intentions. There should be no more questioning motives. The parents and the guardians know what is best for their children. Now, substantive equality also is presumed to apply to the child, because previously, as many of you may be aware, families would have to write letters outlining how substantive equality applied to their situation, which could be very triggering for some and is also very undignified. Families felt like they would need to divulge every aspect of their, personal or intergenerational trauma in order to justify why their child needed that service. So we are doing away with that completely, or I should say this has been done away with. Substantive equality is taken as a given. Now, the request is also presumed to be specific to the child and their needs. This is what we mean by Jordan's principle being a child-first principle. It needs to be the child at the center of everything. Previously, ISK would actually deny requests based on the assumption that a family member might access the support in a sort of ancillary way. So for instance, if a home modification were made for a child who had a physical disability, the justification for denying it might be, well, other families might use, or other members of the family might use this area of the home, which is absolutely ridiculous. And again, moves away from the focus being at the level of the child. And finally, requests are not limited to normative standards under Back to Basics. So in the past, requests might be denied if they exceeded what was available to children through the provinces or the territories or municipal services. This is in direct opposition to the principle of substantive equality. As we know, First Nations kids might need extra supports, and that's for a variety of historical, cultural, and ongoing and contemporary reasons. They might just need an extra bit of help. And so denying things based on what is available at the province doesn't take into account the fact that First Nations kids might be starting at a different place. So normative standards have no bearing under Back to Basics as we know it today. So with this all in mind, I want to take you through the steps of making a request and keeping at the center the sort of components of the request process that have been informed by Back to Basics. So as we mentioned earlier, Jordan's Principle supports are really open to anything that a child might need. So these can be medical, these can be educational, social, cultural supports, basic necessities, if that is what is needed. And these are available to children who are between birth and the age of majority in their province or territory, who either have status or a parent has status, are recognized by their nation for the purposes of Jordan's Principle, or live on reserve. So there are 3 criteria that the child could meet in order to be eligible for Jordan's Principle. Now, requests can also be made by parents or guardians, or any close family member who receives the consent of the parent to make the request. But they can also be made by service providers. So if we're thinking about the pediatricians in Dr. Giroux's last presentation, they can also be made by community navigators or service coordinators. They can be made by the nation themselves, putting in a group request. Anybody who is involved in the child's circle of care and can speak to their needs can put the request in. So how do you make a request? We always direct people to phone the 24-hour line. Now, I will talk a little bit about what we've heard from communities about this approach, but this is what we've been doing because Canada was ordered to set this line up. So we do direct people to call the 1-855 number on the screen. But if you don't have access to a telephone, let's say, you can submit your requests by fax, by email, or by physical mail. So when you submit the request, there are a couple of things, and truly just a couple of things that you need to provide thanks to Back to Basics. So the first is the child's name. And then you'll also need one supporting document from a professional or an elder who can speak to the need. Now, it's important to emphasize that this letter does not need to include an assessment of the child's needs. It does not need to include really long and complex and personal information about the child. It is sufficient for the letter to say, my name is Dr. X, I am the child's family doctor, and I recommend that they receive counseling services every week for the next 10 months. That's it. There does not need to be anything overly personal about the child included in that letter. The third thing that will be needed is the consent from the parent or guardian, and then confirmation of eligibility. So either a photocopy of the status card or a letter from the nation clarifying that the child is recognized for the purposes of Jordan's Principle. I also want to note that in the case of an urgent request, it is sufficient, the tribunal has ordered that it is sufficient to submit the child's name and parental consent only. That's in order to make sure that the child can access these urgent supports as soon as possible without delay. After the supports have been delivered, then you can worry about submitting the professional letter and you can submit the confirmation of eligibility. But to make sure that there are no delays during a time of potentially very acute crisis, the child's name and the consent are enough. Now, I do want to talk a little bit more about documentation as it relates to Back to Basics. So, as I mentioned earlier, one letter from an elder or a knowledge holder is the requirement. And that letter, as I mentioned, does not need to be overly personal. Now, this letter can also speak to multiple different supports. So a request might have various elements to it. This letter can speak to all of these things. It would be okay for the doctor to say, I recommend that this child receives counseling. they will also need physical therapy, and they will also need a particular assistive device. That can be done in one letter. Now, let's say that a child has the example that's coming to my head is let's say they're in a car accident. So right off the bat, they know that they are going to need physical therapy. So they have the professional submit the letter with an initial request for physical therapy. Great. Later on down the road, it comes out that the child also needs occupational therapy. If there is a letter on hand that has already been submitted to ISC for this particular situation, they can go back and look at that letter and use, I want to say common sense, to look at the letter that had already been submitted for the same situation, and then look at this new request for something that is also related to a request that has already been made, and use the existing letter to make the determination for the new request. You don't need to submit a new document for requests that are clearly linked. This is a way that the administrative burden can be reduced. When you're dealing with something like this, you don't need to be running around searching for additional letters and additional documents. So these are things that have come out thanks to ongoing negotiations by the parties to the case, but also that are prescribed within Back to Basics. And we can talk a little bit more about this if there are questions that come up. I do want to say that Back to Basics is a very positive step forward. It's a very strong policy tool, but it's not going to be sufficient in and of itself to solve some of these long-term issues that we've been seeing. So in the absence of a formal complaints mechanism, the Caring Society has kind of been acting as a de facto complaints mechanism. And so myself and two of my colleagues are often the ones who are working directly with families and escalating cases to Indigenous services when they come across the Caring Society. So the proof is in the following examples that there is more to be done. So some of the things that we have been seeing, I would say these are our top 4 thematic areas when we think about the concerns that we've been hearing about. Number 1, delayed determination. So as I mentioned, there are tribunal mandated timeframes during which requests need to be determined. So for urgent individual requests, that's 12 hours. The request needs to be determined within 12 hours. For non-urgent individual requests, it's 24 hours. Or excuse me, 48 hours. For urgent group requests, 48 hours. And then for non-urgent group requests, 7 days. These are enshrined within the tribunal orders, but unfortunately, we're not seeing that. We're seeing requests that are taking anywhere from weeks to months to nearly a year to receive a determination. And we're also seeing that across urgent and non-urgent requests. So there's a clear gap in terms of ISC's implementation and what the orders say. We're also hearing consistently that there are issues with the 24-hour call center. 24 hours gives one the impression that somebody is picking up this phone every single time it rings. And if not, that they're getting back to you within a timely and ideally quite quick period. Unfortunately, we have been, through our own experience, trying to access the 24-hour call center and from what we've heard from families, it's not common that you speak to a live agent. And then if you do request a callback, this can come anywhere from a few hours to a few days after you leave the request. So that is clearly not sufficient in terms of supporting children and families who might actually be in urgent situations. I did see as well, a number of people brought up the fact of reimbursements being quite delayed. So number 1, I think there's a huge issue around the reimbursement model being prioritized on its own. If a family is making a request for help with basic needs, it doesn't make sense that they would be able to then afford to pay out front for something and wait weeks for reimbursement. So ISC has actually committed to a 15 business day turnaround for reimbursements. Now that alone, if we at the Caring Society could push for that to even be quicker, we would. But their committed standard is 15 business days. Unfortunately, we're not seeing that. Unfortunately, we're seeing families waiting anywhere from 3 weeks to many months for reimbursements for supports that have been approved. Now, the other concern that we see quite often are non-compliant and non-compassionate denial rationales. So the common thing that we see are supports being denied because Jordan's Principle is not an income support program. Not only is this really just demeaning to families who are putting themselves out there and making these requests, but it's also not a legitimate tribunal compliant denial. A denial needs to prove that the requested support wasn't addressing the child's needs or best interests. This is actually entirely unrelated to the request because it doesn't have anything to do with the child. It also, excuse me, as I mentioned earlier, it kind of contradicts the fact that Jordan's Principle isn't a program. It's not a policy. It's not a program with a fixed budget. So even if, a family were accessing something like, provincial social security supports, it doesn't matter. That doesn't have anything to do with the child at the level of the child. So these are some of the concerns that the Caring Society has included in our latest round of submissions to the tribunal. It's our hope that these are going to be addressed. We've made it very clear to the tribunal that these are constants. We're seeing a lot of this, and we have been seeing a lot of this for the past year. But it is on the radar moving forward, and we're very hopeful to have some concrete responses in terms of how Canada is going to remedy these things. So in order not to leave on a bad note, I did just want to outline the path forward as we at the Caring Society see it when it comes to Jordan's Principle. So as Dr. Gaspard mentioned, it does not make sense for a request for something like toothpaste to be going through the same channels as something much larger if we think about like a home renovation. So we definitely recommend that low-cost items go through a minimum of red tape. That red tape can be cut by a presumptive approval for a request under $500. This will make sure that kids are getting what they need when it comes to basic needs as quickly as possible. We also know that if Canada is complying with existing tribunal orders, for things about timelines, urgent requests, the orders around administrative burdens, then that is inherently going to improve the implementation overall of Jordan's Principle. And finally, if we plug holes in the other underfunded areas, so if we know that kids are going to Jordan's Principle for education, or we know that there's a huge percentage of kids who are needing medical supports, whatever the area is, government can cost out these services, the ones that are available to kids on reserves, and then fill in the gaps so that kids can be going to Jordan's Principle for exceptional things, for substantive quality requests, because their needs are met through existing programs. So if all of these things are taken together, there's definitely hope that Jordan's Principle can really come back to the true essence of what it was meant to be, which was just a way to reduce government red tape, jurisdictional disputes, and ensure that First Nations kids can get what they need safely, quickly, and when they need them. So thank you for your time. And I guess we'll turn it back to Jennifer for some of the questions.
Yeah, thank you, Molly, so much. So building on what Molly said, I wanted to let folks know that our complete submissions to the tribunal, which went in on October 10th, are on the Caring Society website, along with all of the appendix supplementary information that we reference in those submissions. And Melissa has done a wonderful job of posting all of those links. One of the pieces that we affixed to those tribunal submissions was the presentation the Canadian Pediatric Study. So that is right there in the chat for you. So you'll have immediate access to those slides with the findings from the Canadian Pediatric Society. In the interest of transparency, I will say that Canada replied to our submissions on October 20th. Canada was not necessarily in agreement with all of the pieces that we put forward. And that's why I think for us at the Caring Society, it is really affirming to have these opportunities to gather together in groups such as this one with practitioners and people who are making Jordan's Principle requests for kids to let us know that we are on the right track, right? So Helaina, I'm sure that you have been also looking at the Q&A and the number of folks talking about reimbursement issues is quite a lot. So certainly, you know, it is affirming for us to know that we did right when we put that in our tribunal submissions. So I think that with this, wow, you are all really putting some wonderful and really thought-provoking pieces into the Q&A, and I'm going to do my best to try to address them as I can. Before I go on there, I will say if you are interested in what Canada had to say in response to our letter, that is also on our Caring Society website. Anything that goes before the tribunal or federal court or anything to do with that case, or this case, I should say, we always put on our FN witness timeline. So you can see our submissions, you can see the submissions of the Assembly of First Nations, who, as you know, is also a party to the CHRT case. You can see the submissions of Canada and the evidence they're putting forward. And as we've said from the beginning with this case, what we want to do is to provide the information and to let you decide for yourselves whether you think Canada is treating First Nations kids fairly. So what Molly outlined were our views, and Canada has their views, and all of that information is there for you to review and to decide for yourself. So gosh, where should I start? Where should I start? I will, I guess, start by talking about eligibility. So there were a few comments in the Q&A about eligibility, and I think there might have been some misunderstanding around if off reserve, if children living off reserve are eligible. They absolutely are. So just for complete clarity, I did address that in the Q&A and it's posted in the chat, but let's just take a minute to make sure that we all understand that First Nations children, regardless of where they live, are eligible for Jordan's Principle. A question that might be one for Helaina, actually, if you don't mind starting us off. There was a question right early on from Rebecca, who is wanting to know what is being done about the inequitable implementation of Jordan's Principle across the provinces. Rebecca says that BC is so far behind the eastern provinces. And so I was wondering, Helaina, if you could talk to us a little bit about how far along you've gotten into this phase of the Jordan's Principle study, because I imagine regional variation might be something that's coming up at those discussions with practitioners.
Thanks for the question. So there is a great deal of regional variance that we're learning about in the operationalization of Jordan's Principle. We're working with a group of regional practitioners that are helping us unpack some of those differences, explore them, also see what's working, right? If some regions are effective or demonstrating that they can be really effective by engaging in certain practices. We know that, for instance, in Alberta, there have been examples of things like gift cards that have been able to be used in that province, but not in others. And so it's about exploring what works and where, and hopefully of finding ways of replicating what works to help not only move those applications or the adjudication of those applications, move them through the system faster, but also to help make sure that we're doing it sensibly and practically as possible for kids. Jennifer, if I may, there was one other question in the chat about, is that okay?
Yes, please.
Okay. Okay. There was another question in the chat about ISC's expenditures and will changes in expenditures impact Jordan's Principle. So I just wanted to speak to that because it's a good question. So departments are required to present plans to Parliament for their spending every year, their anticipated plans. Part of what IFSD is assuming is that ISC, so Indigenous Services Canada, will not be able to publish its allocations for Jordan's Principle for a few different reasons. One is because they might be unsure how much money will be spent for Jordan's Principle and when. That might be one consideration. The other consideration is that there are the ongoing deliberations associated to the Canadian Human Rights Tribunal. The main message, though, is that Jordan's Principle will be funded. So we know that if you were to look at what the Government of Canada calls InfoBase, you see a flatlining almost of Jordan's Principle expenditures looking into the future. That's not what's anticipated at all. Jordan's Principle will be funded. It's just that they might not know how much is expected to be funded or when, paid or when expended and when. And that just might be why it's not being reported, but the funds will be there.
Helaina, are you referring to the question from Carrie about ISK spending cuts impacting Jordan's Principle?
Yes.
Okay, because you know I was going to put that question your way anyways. Not a pediatrician, not also someone who understands numbers. So I saw that Institute of Fiscal Studies and Democracy would be one to speak on that. Now, if I can, I guess, elaborate on that question, you know, I think the message that is getting out to folks is that ISK is cutting their budgets, right? ISK is needing to save money. And so that, I think, is the headline that people are seeing, hearing. But what you're saying is maybe it's not the concern that we might think it is. Is that?
So budget cuts, of course, in general are always possible. Parameters change, policies change, politics change. But our understanding is that Jordan's Principle as a legal principle is going to continue to be funded. So if you're looking online and you're seeing those numbers getting really, really small after, you know, we're looking at upwards almost 900 million in spending for 23-24 through Jordan's Principle, and you see that number decreasing just into about 12 or 13 million, or projected rather to decrease to that amount in the fiscal years ahead. We don't anticipate that that's the actual plan. What we are anticipating is that Indigenous Services Canada might just not have a sense of how much it's going to expend and when, and it might also be waiting just to complete the negotiations to update or to refresh some of those expenditures. But our assumption is that Jordan's Principle will continue to be funded.
And for clarity, everyone, Helaina is not with Indigenous Services Canada. You know, she's here today with the Institute of Fiscal Studies and Democracy, which is out of the University of Ottawa. But I am looking to her because she understands numbers and understands public finance. But, you know, Helaina is in no way speaking on behalf of Indigenous Services and certainly didn't want to put you in that position, Helaina. I think on the Caring Society side, we, you know, might wonder if ISK is needing to look at budget cuts somewhere. And there is perhaps the suggestion that more staff are needed to you know, facilitate requests that are coming in. If the budget cuts are needed, is there still going to be that room to potentially increase staff? I think that's also a question that is on minds. And again, not one that you can answer, Helaina, but you know, some of these pieces are unknowns, I think.
I think you said it really well. Well, I can't answer for Indigenous Services Canada. And what we can say is that IFSC, so our organization, we are looking to understand and to think about different ways that Jordan's Principle can be implemented on the ground, right? We've heard a lot about different regions doing different things and working with Jordan's Principle in different ways. And so I think there are a number of questions that could be helpfully explored with the contributions of practitioners.
Thank you. Now I want to go over to Molly, because we have a question here specifically that might be useful to all folks. Amy was wondering if you could repeat the information you were sharing about what a denial has to show.
Yes, of course. So a denial at its root needs to be able to prove that whatever the request was for does not have anything to do with or meet the child's needs or best interests. So a denial can't be based on something outside of that. It also needs to consider, so if we think about a request, having to keep in mind the needs and the best interests of the child, culturally relevant service provision, substantive equality, and distinct community circumstances, then the denials need to be based on that as well. So those are the only rationale that can be provided that are in fact compliant with tribunal orders. Anything outside of those decisions or rationales is not compliant because it doesn't actually have anything to do with the child. So the example that I used was Jordan's principal not being an income support program. And so they're going to refuse funding a service to a family. It often happens in the context of basic necessities. So if a family is requesting support with groceries or clothing or a hydro bill, let's say, Jordan's principal might come back and say, well, no, like we are not an income support program. We're not intended to be a long-term income support program. This is denied. That's not compliant, point blank, because it doesn't actually center the request around the child.
And I would add to that excellent information that if your request is denied, you should also be able to understand why your request is denied, right? Because as part of Jordan's principle, you also have the right to appeal. So if your request, if I make a request for, say, my daughter and my request is denied, I have the right to appeal that. But in order to have a meaningful appeal, I need to understand why that request was denied, right? So Canada has an obligation to provide specific and personalized information about why my request was denied. So, you know, I shouldn't get a letter back saying, you know, this request, as Molly said, is not in keeping with substantive equality. And I'm here thinking, well, but I submitted everything that you asked for and then explained why it was. I don't understand why you think this isn't in keeping with substantive equality, right? That denial letter needs to explain why ISC thinks that in this example that I'm giving, the request is not in keeping with substantive equality. If you receive a denial letter back that is not specific in that way, you absolutely have the right to go back and say, I am aware that I am that I have a right to specific information about my request and why it was denied. And you have an obligation to provide that to me. Because in the absence of that kind of information, the appeal can't be seen as meaningful, right? If I don't know why you denied my request, how can I then provide additional information to show you that that decision was an error? So that's something else to keep in mind about denial letters. And we are aware that sometimes denial letters are not providing that specific and personalized information that requesters have a right to. And so really what we can say about that at this point is that as the person making the request, you absolutely have the right to push back on that and say that you know that you have a right to that personalized information. So there have been also some questions here about back to basics, and I really appreciated that Molly took the time to talk about where back to basics came from. I know for those of you who have been working in this area for a bit of time, you might remember that when back to basics was rolled out, for lack of a better term, there perhaps wasn't a lot of communication on behalf of Indigenous services to say what back to basics is. I remember I had service coordinators contacting me and saying, hey, have you heard about this thing called back to basics? Like, what does it mean? Does it mean that requests are now only going to be considered if they're basic? And so what's really important for you to know is back to basics was actually something that the Caring Society and AFN collaborated on with Indigenous Services Canada to try to address some of the non-compliance issues that we had seen, 2020, early 2021. Molly, when did back to basics roll out? Time is just coming together in my brain. Was it 2022?
It was early 2022 after the AIP.
Yeah. So Back to Basics came about when the Caring Society and AFN said, hey, we need to do something to address some of these non-compliance issues that we were seeing, that AFN was seeing, and that we were hearing about from folks such as yourself. So for example, the substantive equality piece was one of them, right? You will recall prior to Back to Basics, and someone mentioned this in the chat, that their request was denied because they hadn't proven that substantive equality applied. And some of the thinking that went behind Back to Basics was, you know, the AFN and the Caring Society, and even some folks inside ISK, as we were having these discussions, saying, you know, show me a child in Canada where substantive equality shouldn't apply. If we're thinking about the residential school system, we're thinking about land dispossession, we're thinking about the 60 scoop, we're thinking about missing and murdered Indigenous women, you know, we're thinking about resource extraction. Who, you know, is not impacted by these things as First Nations families, right? So the presumption of substantive equality was one of those pieces that was eventually enshrined in Back to Basics. And the purpose behind Back to Basics and sharing it, you know, having it on our website, having the information sheet about Back to Basics that Melissa has put in the chat, and having the Back to Basics document on our website, the same one that ISK uses, is for folks on the ground to be able to read that and say, if, you know, if they're seeing something in the correspondence they're getting from ISK, for you to be able to refer to that information and say, again, I am aware that per Back to Basics, I don't need to submit multiple letters. I am aware that one letter is sufficient. I am aware that you are not able to override professional recommendations, right? All of these pieces, they are outlined for folks on the ground, such as yourself, to be able to refer to and to assert, you know, those rights that you have and that families have. Okay. Where should we go next? There was an important question in here about urgency, and Molly, this might be one that you want to take on. There was a question asked about who determines urgency, right? And who gets to make that call?
Sure. So certainly if we think about parents and guardians having the best sense and understanding of what their child needs, that call can be made by parents 100%. So when you make a request, you can let the person on the phone know right away that this is an urgent request. And some of the things that might fall under urgent requests are mention of suicide, palliative care, the risk of a child coming into contact with the child welfare system. So not even necessarily apprehension, but, you know, child welfare being triggered and then having sort of an alert about that child. No access to basic necessities as well. These are all things that can be considered urgent. But again, a parent or guardian will also have a sense of what that means. So you can alert the person on the phone, but it's also important to know that if a request maybe isn't urgent from the start, but then becomes urgent later on, if something changes in the child's needs or context, then you can absolutely call Indigenous Services back and let them know that, hey, this is now an urgent request and it needs to be flagged as such and processed in the tribunal compliant timeframe for an urgent request. We do know that ISK employees can also kind of use their discretion to flag things as urgent, but ideally this will be coming from families self-identifying the case as urgent. I hope that clears things up a bit.
Yeah. And since we're still on the topic of Back to Basics, you know, some folks have been saying in the chat, are all ISK employees aware of Back to Basics? Because in their work, they are seeing that, you know, perhaps it's not being adhered to. So I guess the answer from the Caring Society's perspective is they should, right? Because this is the official approach that ISK has committed to. If they are not, then you absolutely have the right in your roles to reference that document and provide that clarification about what the obligations are. What should we do now here? There was a question about, this is the one I wanted to come back to. Justine had asked, what would the elder state in the letter of support? So this is around letters by professionals, right? And so I think that when we're talking about elders, and we're talking about professionals in general, we're talking about what would you think that professional has the expertise to speak on, right? So if I'm a dentist, I probably shouldn't be writing a professional letter for something to do with, heart surgery, right? So when we're thinking about the expertise, and we use that word very deliberately, of elders, we are thinking about, Jordan's principle also exists to provide cultural supports and to meet the cultural needs of the child, right? So we absolutely want our elders and traditional knowledge people to be able to say, I know this child and they would really benefit or really need the opportunity to go to a land-based camp, for example, right? Or to attend this particular ceremony, or to attend this, particular program that might be offered by the community that isn't medical, but is absolutely about their well-being. So that is the idea with the letters. Molly, is there anything that we should add to that?
No, I think you've done a really good job of kind of covering what that means. I think broadly, we're looking to the elder for the cultural supports. And then, of course, if they do happen to belong to a professional college, it can also be the recommendation for the medical or, the educational or what have you. But yes, we do include that deliberately to speak to the more cultural supports, which are also often the more substantive equality-based supports as well.
Yes, thank you, Molly. Our elders are pretty much the best. So there's nothing to say that our elders aren't elders and also heart surgeons. Helaina, I want to come back to you for a moment. Is there anything that we've been touching on or that you're seeing in the Q&A that you would like to build on or address specifically?
Oh, I appreciate the offer, Jennifer. I think a couple of things, both challenging and reaffirming, is that we're starting to see consistency in the nature of some of the challenges that have been highlighted. So concerns about Jordan's principle and capital, that's been something that's been shared with us. Challenges associated to reimbursement and timelines for response, as well as considerations associated to school and school board support or access for Jordan's principal requests, both on the individual and the group side. So just to say, we're keeping an eye on some of these considerations and challenges that have been raised, and that the working group that are very generously sharing their time with us have also echoed similar challenges and considerations. So we'll do our best to help unpack these as much as we can together, and hopefully build them into, or build some responses into, the work that's moving forward.
Yeah. Thank you, Helaina. As you said, it's not nice to be able to see the consistencies and the concerns that are coming forward, but it is helpful in knowing what needs to be pushed and addressed. So thank you for that. I'm seeing some questions here about the National Review Committee and how long it should take to get a response back. With that, I think all we can say is that the timeline for determination is the 48 hours, and it doesn't matter whether it goes to review committee or is determined in the region. That being said, I think the number of comments that we've seen in the chat make it pretty clear that those timelines are not being honored. But simply to answer your question, Emily, who posted at 2:31, how long should decisions take after getting to the National Review Committee level? They shouldn't take any longer than any other request. So, for what it's worth, that's the answer. Yeah, and here's another one that I think we want to address here. Sorry, everyone, I'm reading these questions in real time as you are. So if I look a little distracted, that's why. There have been a few questions about folks wanting to know if there is, limits on the number of times a family can make a request. And I think this is really where we want to shift our mindset from, that old programmatic type approach where we would be asking ourselves, what's covered? Am I within the eligibility? How often can I do this? Those are not the questions that we start with when talking about Jordan's principle, right? The question is, what is the needs of the child? What are the needs of the child, I should say? Have those needs been met? And if there are outstanding needs, then, that's when we look to Jordan's principle for that support. The question, I think, that as Helaina flagged for us earlier is, why does the child have that need in the first place, right? Is it because the service doesn't exist in the community? Is it because other federal programs like NAHB aren't covering this particular need? Is it because of, poverty in the community? Is it a lack of provincial resources, right? We know that so many children are thankfully getting support through Jordan's principle, but why are they needing to make the request in the first place? And if these are things or needs that should ordinarily be met as just a matter of course, then why should our children have to be making requests, right? Why should our children need to be going through a request-based process to get things that might ordinarily be met for all of their children as a matter of course? And, I've heard people refer to Jordan's principle in this way as a golden band-aid, right? The Jordan's principle is meeting or covering the gaps or, patching the hole. And I understand the sentiment, but, it does hurt my heart a little bit, right? When we think about Jordan's principle, having been gifted to us by the Anderson family and, have had to result from the experience of that little boy, right, in that hospital, and him living there for all those years that he didn't need to. And I've heard the Anderson family say that they feel in the end he died of a broken heart, right? And so I think that's another one, when you hear these phrases like Jordan's principle is a golden band-aid, that we just all really need to come back to where this principle came from and how we got it, right? It's a lot to take in. So let's see here. Maybe, Molly, would you be able to talk a little bit about the review process for appeals? So if, say, I'm a parent caregiver, my request has been denied, I've decided to appeal. What does that mean? Where does it go? And again, we're speaking from our understanding of the process as the Caring Society. We're not ISK, so we don't know all the ins and outs. But generally speaking, Molly, information about what happens when folks appeal might be useful.
Sure. So I think it's important to mention, as you did earlier, Jennifer, that when a request is denied, your denial letter should include specific and personalized information about why that decision was made. Now, you have the right to appeal that decision. So by letting the department know that the decision that they made was not correct, and that's either because you have other information to prove it, or that it was just simply not correct. So once you appeal a decision, it gets sent to the National Appeals Committee, or the Appeals Secretariat, I believe it's called, which is an arm's length committee from Indigenous services. So the benefit to that is that they are completely separate from the department, and you're going to have fresh eyes on your application. So you can submit the application as is and just say, look, this decision was not correct. I'd like this to be reviewed on that ground. Or if you did receive a specific reason as to why the request was denied, let's say that it was denied because it was not, it wasn't going to meet the needs of the child, then you could actually gather additional information to submit alongside the request that proves that, in fact, this is in the best interest of the child. And here is an additional letter from a professional who can further attest to that. So once your appeal has been submitted, you'll hear back directly from the I believe it's the region who will then respond, or the National Review Committee. You'll hear back about your case. If it is approved after the appeals process, that's great. You'll receive information about how you'll go about accessing the service or getting the reimbursed funds. But let's say that unfortunately the denial is upheld at appeal. So unfortunately, they're not going to budge on the decision. The next step would be to file a judicial review, which is essentially the process of asking the federal court to weigh in on the decision and look into whether or not that decision was made fairly and equitably. So you can go through the judicial review process with or without legal representation, but that is unfortunately what the next step is. Unfortunately, there's no further appeal process to appeal an appeal. But you do have the right, if anything changes for that request, anything in the child's needs or their circumstances changes, you can resubmit that request as an entirely new request. So you're not barred from ever making that request again if it's denied and say the denial is upheld at the appeals committee. You can resubmit it. You do have the right to resubmit if anything changes.
So that's what happens with your questions about appeal. I think that there are some questions that I'm seeing in here around, okay, we know that there are these concerns. What can we do about it? There was questions about the Caring Society following. How often do we follow up on particular things? So as I think everyone here knows, there is no official complaints mechanism if you're having concerns about Jordan's Principle. The Caring Society has kind of stepped into that role to a certain extent about trying to flag situations to head folks at Indigenous Services Canada when they come to our attention. What you might not know is we are a pretty small organization. We're about 8 people. So with Molly and myself on this call, you have about half the people at the Caring Society who work on Jordan's Principle. So we know that it's not a sustainable approach. But we are going to, continue to push at the tribunal until there is evidence that the discrimination has stopped and that ISC has those adequate measures to show the tribunal that it's not going to happen again. And sometimes we get questions about how long will the tribunal have jurisdiction, right? And so it's important, I think, to understand that the jurisdiction that the tribunal holds is not about a particular time period. It's until Canada and the parties have submitted evidence to the tribunal's satisfaction that discrimination has stopped and that Canada has taken those adequate measures to prevent it from happening again and to address the measures or to address the concerns that have been put forward by communities and families and organizations such as ours. So, I've seen in the chat, there is, questions about, well, what is ISC going to do about the concerns that are being put forward? So with that, I would really encourage you to read their submissions on our website, right? So I don't want to speak for Indigenous Services Canada as to, what their plans are, but I have it right here. This is their letter of October 20th. So you can go and check out what they have to say about their views on how Jordan's Principle is proceeding. Helaina, Molly, any questions in here that are standing out for you?
So there is just a question in the chat about ongoing research surrounding advocacy efforts and some of the systemic gaps. And so part of the response is we are absolutely doing our best in this round of work to connect with people on the ground that are actually working in Jordan's Principle to help to understand where some of those operating concerns or those implementation concerns lie. And that can be everything from the application process all the way to other more, say, complex questions about who's delivering Jordan's Principle and how. So we're doing our best to connect with professionals and practitioners on that front. When it comes to the gaps surrounding adjacent program areas, we're doing our best to tackle that in a couple of different ways. One is by looking at existing work and doing some cost or gap analysis about program areas that we've identified as being related to Jordan's Principle. We think here about things like education and water. For instance, the Parliamentary Budget Office has costed gaps in those areas and even updated some of their costings in those areas for First Nations in community or on reserve. So that's one way that some of those gaps are being addressed and considered. The other is by hearing from those of you that are active in the area, even in the chat today, the considerations associated to things like basic necessities, right? Gaps for groceries or basic needs. Those are helpful for us to understand as well, because that can help us turn our attention to some of those existing policy program areas and also help to flag them should they not be, formalized as a program or service. Touch on a really important point that was made in the chat about the importance of understanding well-being, the importance of measuring well-being in relation to Jordan's Principle. So in past work related to, not in past work, in ongoing work, I should say, related to child and family services, IFSD worked closely with agency directors, with experts, with First Nations to help build a framework for understanding or for capturing well-being in the context of or in relation to child and family services. And so that's very much a preoccupation when we're talking about Jordan's Principle, especially when we think about community and the places or contexts or environments in which children live. And so those considerations about indicators for well-being, that's something that we're quite aware of here. And we also will be working with our regional working group to help to identify what some of those indicators might be in the context of Jordan's Principle. And importantly, maybe working together, we can also identify some things that those practitioners or professionals think should be asked anytime you're making a request to Jordan's Principle, so that we're not just looking at the immediate request before us, but that we're also starting to think a little bit more broadly and starting to make those connections between the services and requests that are being made and some of those broader or longer term considerations and challenges. And I see that there are also a number of comments associated to differences in where folks might seek support, whether that's through a child and family services agency or working through coordinators, navigators, those sorts of questions. So we're doing our best to actually help to capture those different considerations and actually start to map what Jordan's Principle might look like in different places. So we certainly appreciate that you're highlighting all of these considerations for us here.
Well, with that, I think we are coming to the end of our time together. I really apologize that we couldn't get to everybody's comments and questions, but please know that we are taking note of them, and that I think there is some repetition here that hopefully has been addressed through the links that Melissa has put in the chat. I will say that if you are aware of a situation, an urgent situation with a child, we are not, the Caring Society we're kind of an ad hoc sort of solution in the interim for moving things along. But if there's an urgent situation that you're aware of that needs to be actioned, that you're waiting on something, you can get in touch with us at info@fncaringsociety.com. And we can try our best to try to flag it to folks who might be able to get some action going. In closing, I did want to highlight or speak about a question regarding Jordan's Principle and compensation. So, we're 300 people on this call. Chances are, someone who might be eligible or should be eligible for this compensation. There is a website fnchildcompensation.ca. And I think Melissa will share it, but it's fnchildcompensation.ca. That website is managed by the Assembly of First Nations. And it has links where you can go to sign up for, the latest information about where compensation is at. For now, just know that, you haven't missed anything in terms of, making sure that you are honored and respected through that compensation process. Nothing is really rolling yet. I also wanted to highlight just the Caring Society's role in terms of compensation. So as of this federal court hearing today, in which the class action parties have gone before the federal court to ask the federal court to sign off on the agreement, the Caring Society is no longer that involved in the compensation. Again, I'm going to use the term rollout for lack of a better word. Our role with the compensation agreement was to weigh in on whether we felt that the agreement met the tribunal orders on compensation. So, in the early proceedings of the tribunal case, the tribunal had ordered compensation for victims of Canada's discrimination at a level of $40,000 and had set out particular parameters of people who needed to be respected through that process. Our role was to make sure, or the role that we identified for ourselves in the class action process was to make sure that whatever agreement eventually went forward, at a minimum, met those tribunal orders. And some of you may remember that we put forward submissions prior saying that that original agreement, didn't meet those tribunal orders. The tribunal agreed with us that the first class action, or the first compensation agreement was not sufficient, ordered the parties back to the table, and a new agreement was made, which we feel and the tribunal feels does respect those orders. So with those minimum human rights standards being established, the Caring Society's role in the compensation is now, we're not really at that table anymore. So that's why we are flagging for you this website, fnchildcompensation.ca, where you can get those up to date, the pieces. So with that, we are 2:57. Everybody has made it through a 2-hour-long webinar, which is no easy feat. So I would just like to extend our sincere thanks on behalf of the Caring Society, on behalf of FN Cares, who hosted this amazing panel today, for joining us. And if you have colleagues who weren't able to get on due to us reaching capacity with our link, please let them know. This will be recorded and everybody will be able to access the information in due course.